Happy Sunday. It's a beautiful one, and I figured I'd take this nice little stroll and share with you guys what's on my mind, even though it doesn't directly affect me personally because I'm not shopping in the marketplace right now. But it's going to be an interesting situation come November 1st. If you or anybody you know is shopping in the marketplace, I would recommend start looking now. Start making plans do, especially when it comes to the premiums, when it comes to the choices that you have. I've been saying for a while, when I look at these plans, and I've been helping people get marketplace plans for the last maybe 4 or 5 years now. And now, the more I look at these plans and match people, what seems to be happening is the premiums keep going up, the deductibles are going up, and the benefits that people are getting are going down. And people are looking, trying to find options, trying to find solutions to this problem because it just doesn't make sense. The sad thing is, it hasn't made sense for a long time. But for a lot of people, it seems like that's the only solution that they have when it comes to finding out options. Everyone runs to the marketplace if there's no employer-sponsored plan. So basically, it's going to be a sad situation for a lot of people if they wait. And the reason I'm making this video is I looked, I believe it was today, Sunday. It was on Friday, I believe. I checked on Covered California, which is the marketplace where you can get your insurance plan if you live in California. That's where you go shopping for healthcare, health insurance specifically. And what I noticed was that 2026 plans were available. 2026 plans were ready to go. As far as you can see what the options are, and I just took a random situation and put together to see what 2025 versus 2026 look like. Same family, same plan, same income, because we know income doesn't go up nearly as fast as all the other things. So just to compare with this specific case, this example, we're looking at a, call it $800 increase in just premiums alone. 800 in premium every single month, that is. So a family that was paying about 800 now is looking at paying about 1600 just in the premium to say that they have insurance, not necessarily using it for any healthcare needs or conditions, but just to say, hey, if something happens, there's something in place for me. And that's where I see that as a big problem. And most people just don't have a solution. So I want to help and let you know that there is hope. If you're somebody that's in that situation, there is hope. But I would recommend not necessarily looking in the traditional insurance marketplace for that solution, because one thing that I find that most people seem to overlook is that when you shop in the marketplace, or even if it's an employer sponsored plan that they're providing, have you guys noticed that they're all insurance companies? It doesn't matter if we're doing a marketplace where you're shopping individually for yourself, your family, or if it's an employer that's providing you with that coverage. It's your United Healthcares, your Blue Cross Blue Shields, your Kaiser Permanentes, whatever it is, it's an insurance company. And everybody knows that the insurance marketplace is in shambles right now, to say the least, right? The state of insurance as a whole is not in the greatest position. And one thing that I would just encourage you to do your own research on is that health insurance does not equal health care. I'll say it again, I've said this before, but health insurance does not equal healthcare. And a lot of times people think that if I have the most expensive health insurance, then I have the best care when it's time and I need it. And that's, again, not the case. So I don't want you to get fooled into thinking that because I'm paying the most, I'm going to get the most out of this plan when the time comes. I've seen people think that, and when the time comes, they find out that they're out of network and the plan doesn't even cover the expense that they thought they were paying high dollars every month for. So the system is confusing, and it's designed to be confusing so that way you don't know what's happening, except you have to pay every single month. Whether you use the plan or not, there's a bill that's coming to you. So what I'm doing is making sure that I offer the solution that I've learned about, even though I'm a licensed insurance professional, right? I'm a licensed broker, if you will, that can help folks all over the country, pretty much all 50 states. But I realized that the solution with insurance is not what people are looking for. And I found other solutions that are non-insurance products, but provide you with the healthcare that you're looking for. So that's why I make sure that I provide the information to anybody that's interested in learning about these alternate solutions, these non-insurance options that really provide you with the care that you're looking for. So if you haven't already, feel free to subscribe, feel free to follow the channel, because I'm going to be putting so much more information with everything that's going on again with the insurance market, so that everybody that needs healthcare coverage understands that there are options and they don't have to go to the marketplace or shop directly for insurance as their healthcare solution, since there are better ones. What I see is a lot of people not talking about it because it may not necessarily get them the compensation. For example, when I first got licensed in insurance, I actually worked with Allstate. And those of you who know, Allstate only has a certain amount of products in their portfolio that they can offer. And if somebody needs a product or service that Allstate doesn't offer, guess what? I can't help. And for some people, they're not worried about helping you or the people that are coming to them seeking the advice, since they're a professional. They're worried about making a paycheck. And at the end of the day, they could care less how that product that they sell you actually works or helps solve the problem that you came to them for. Some people just want to make a bonus, make a check, so that they can take care of their family and do what they need to do. And for me, I don't operate that way. I don't think that you have to lose or you have to get a crappy product that doesn't necessarily suit you in the situation that you're in just so that I can win and get a paycheck or get a commission, right? I believe that there's a win-win situation where everybody can win and get what they need without anyone having to lose. So like I said, if you or anybody that you know is interested in learning more about how we can take back control of our healthcare, and you want to get started, because this isn't anything that I'm hypothesizing on or still working out. There's a solution right now. Thousands of people are using, and they're saving every single month on their healthcare, and they're actually, in most cases, getting better care than they are with their traditional insurance plan, and than they were, I should say. Because once you see the difference, in my opinion, it just makes sense. But like I said earlier, most people that are licensed aren't talking about it. They're just taking you from one insurance marketplace or platform to shop for the same exact product that doesn't necessarily serve you, right? But it gets them paid, so in their eyes, why not? But I'm just here to tell you that there's a better way. And if you were to ask anybody who shopped for insurance, if they're a business owner or an individual, I've had several conversations with people that got frustrated just with the amount of time that it takes to be able to get signed up for a plan in some cases. And as you know, everybody likes to wait till the last minute. So it's another reason I'm doing these videos. Every single chance I get, if I can remind you to start shopping early, start doing your research early, it just allows you more time to make a better decision. But I can't make you do anything. The choice is yours. You have to take action on that research phase to figure out exactly what you want, because I don't know what your conditions are and what your needs are. But I do know that most people will tell you to go get the marketplace plans or an insurance plan from somewhere, and that's the solution. But it's a beautiful day, and I had this on my mind, especially since I did that analysis today just to compare 2025 versus 2026 here in California. And man, when I saw that difference of about 800 with everything else being the same, and then some people not being ready until the last minute, I figured maybe I could help one person today with this video. So again, if you can share, help this information get spread to the people that need it, I'd appreciate it. And if that's you, feel free to subscribe again and stay tuned for more, because I'll be sharing more as we get closer and closer to open enrollment and beyond, because I know some people are going to miss that deadline and still be wondering, man, I missed the deadline. How can I get coverage now? Without a qualifying event, it's bad. There's going to be no chance until the next open enrollment. But like I said, there's something much better that I'll be willing to share if anyone's interested. So till the next one, guys, be safe, and we'll talk.